maybe 30 seconds or so, and we would appreciate any feedback you have. So now I'd like to introduce Santonya. She joined Blue Cross and Blue Shield of Illinois in 2019, and she started her career in the healthcare industry in 2016, where she found her passion for working with the aging population. She has experience educating the community about Medicare, Medicaid, and other government programs. She continues to pursue certifications and training to increase her knowledge about ongoing changes in the healthcare industry. As a Think Blue ambassador, Santonya has built and maintained strong relationships in the community by implementing Medicare community outreach programs, such as this one, organizing events, and volunteering. Her mission is to serve Blue Cross and Blue Shield of Illinois members and communities and help them live better, healthier lives, one person at a time. So Santonya will be presenting today about Medicare Advantage. So I'll go ahead and turn it over to her. Thank you.
All right, thank you, Emily, for the introduction. So yes, once again, good morning, everyone. My name is Santonya Scott. I am the Community Relations Specialist with Blue Cross Blue Shield. As my position, I go out into the field to educate seniors with our Medicare overview and our Medicare plans. So today, of course, you're on the presentation that we're going to be discussing Medicare Advantage. So this is just a brief overview. So if Emily mentioned, if you wanted to have some questions that you feel free to put them in the chat, or else you can hold them to the end. So I'm going to go ahead and start the presentation. Thank you. So once again, welcome. My name is Santonya Scott. I'm a community relations specialist. I'm also licensed to sell health insurance in Illinois and certified to sell Medicare Advantage and prescription drug products for Blue Cross Blue Shield of Illinois, and may be compensated based upon your enrollment in a plan. Also, we are here for you. We're here to help you make an informed decision about selecting a Medicare Advantage plan with a prescription drug plan. So let's go ahead and get started. So this is how we put you first. We have dedicated support services in person and over the phone. We have an extensive provider and pharmacy network. We have excellent benefits. We have comprehensive coverage. And then we are the leading local choice for health coverage. Here's how we can keep you healthy. We have an over-the-counter allowance that ranges between the amounts of $50 to $75. Allowances are every 3 months for purchasing over-the-counter health products available by Blue Cross Medicare Advantage HMO plan. And unused over-the-counter allowance do not roll over the next calendar year. If anyone needs to have that list of over-the-counter drugs that are allowed to get this allowance, feel free to also put that in the chat and I can email that to you. Also, the $75 allowance every 3 months for purchasing over-the-counter health products available on Medicare Advocate Health HMO and Blue Cross Medicare Advantage Plus HMO POS plans. Unused over-the-counter amounts, once again, do not roll over to the next calendar year. We also have a prescription drug coverage, with which we have our preferred pharmacies, Osco Drug, Walmart, Mariana's, which is Kroger, and then of course, Walgreens. We also do provide Silver Sneaker fitness programs with our Medicare Advantage plans. So Silver Sneakers is a free gym membership to a participating gym that accepts the Silver Sneakers program. And also, once again, we do have a website that you can go on to put in your zip code and get a list of participating gyms in your area that is under this program. Sorry. And then also we do routine eye exams. We have 24/7 nurse line, which is good right now, especially during the pandemic. If you have any questions or concern, the nurse is available for 24 hours, 7 days a week. Also, we have tools to easily manage your plan and health tips and important information. That website is bcbsil.com/Medicare. And then we have close coordination between healthcare providers. So they keep us aware of any changes that they're having within their provider network. So we make sure that we communicate so everybody's on the same page. So now I'm going to discuss Medicare Basics. So are you eligible for Medicare? So if you're age 65 or older, or under 65 with certain disabilities, and any age with end-stage retinal disease, also known as permanent kidney failure, requiring dialysis or kidney transplant, and diagnosed with ALS, also known as Lou Gehrig's disease. So these are the eligibilities that you can have if you're eligible for Medicare. And then for the disability, for Social Security, you have to be on Social Security for 24 months in order to be eligible for a disability if you're under 65. So now we're going to discuss the ABCs of Medicare. So we're going to start off with Part A. I know this may be a refresher to some people, but if not, this may be something new or something you heard of or maybe confused about. So this is what this seminar is about. So Part A is a hospital insurance, which is also known as Original Medicare. It helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. And while most Americans are enrolled automatically in Medicare Part A, it alone may not cover all healthcare costs. Parts B, C, and D are voluntary programs that provide additional coverage. So just a refresher once again, for the Original Medicare, it covers 80%. That means you are responsible for the other 20%. So now we're going to discuss Part B, which is also Medicare medical insurance, Original Medicare, and it helps cover services from doctors and any healthcare providers, outpatient care, durable medical equipment such as wheelchairs, walkers, hospital beds, and other equipment supplies, and many preventive services such as screening shots and yearly wellness visits. So that can be your yearly checkup, mammograms, colonoscopies. So that will be under your preventive services. And then keep in mind, if you do not enroll in Part B when you're first eligible for Medicare, you may have to pay a penalty later. So if you do have credible coverage, meaning that you're still working or your spouse is working with an employer with 20 or more employees, that's considered credible coverage. So you can delay enrolling into that Part B without getting a penalty. So now we're going to discuss Part C, which is sometimes confusing. Part C is not a part of Original Medicare. So Original Medicare, once again, is Part A and B, and that's your red, white, and blue card. And then Part C is a Medicare Advantage plan. And it refers to Medicare Advantage program where members can enroll in a private health plan. Part C is an alternative to Original Medicare's Part A and B, and it may or may not cover prescription drugs. So it's considered an all-in-one plan. Then we're going to talk about Part D, prescription drug coverage. It covers outpatient prescription drugs through private plans that contract with Medicare. If you don't enroll in Part B when you're first eligible, once again, you will have to pay a penalty later. But as I mentioned, if you do have credible coverage through an employer, you can delay enrolling into your Part D as well as your Part B without getting penalized. So what is a Medicare Advantage plan? So a Medicare Advantage plan, sometimes called Part C, as I just mentioned on the previous slide, or a MA plan, is all-in-one alternative to Original's Medicare Parts A and B, and Medicare plans are offered by private companies and approved by Medicare. So I'm sure that a lot of people have been receiving postcards and information through the mail and seeing commercials on TV, because right now it's annual enrollment. So they're doing a lot of advertising for this particular plan. So Medicare Advantage plan bundles together Medicare Part A, which is your hospital insurance, your Medicare Part B, which is your medical insurance, and then Medicare Part D, which is your prescription drug coverage. So these are Medicare Advantage plan bundles that together. So Medicare Advantage plans are not Medicare supplement insurance plans. They are two different plans. So there are two different plans. You cannot have a Medicare Advantage plan and a Medicare supplement insurance plan at one time. So either one or the other. So Medicare key takeaways: when you join a Medicare Advantage plan, is it important to remember that you are still in a Medicare program and that's your plan. You must follow Medicare rules and notify you of any changes before the start of the next annual enrollment period. That annual enrollment period, once again, it's October the 15th through December the 7th, and you will pay that Medicare eligible services. You must offer the same benefits as Original Medicare Parts A and B, which is once again your red, white, and blue card. plus other benefits and services that usually have different rules, costs, and restrictions. So when you go to the doctor, you would show your plan's Medicare Advantage card, not your Medicare card. So now we're going to discuss Blue Cross and Blue Shield of Illinois Medicare Advantage plans. So a plan with advantages for you. We offer HMOs, HMO POS, and PPO plan options that include extra benefits. So just for those, once again, who are not familiarized with these acronyms, HMO plans typically have a lower monthly premium in a particular network. So that means you have to find a participating provider that accepts the HMO, and then you have to have a referral if you need to go to a specialist. So a HMO POS is a point of service plan. It has a lower premium than a PPO plan, but still provides options choosing healthcare providers. And then the last one is a PPO plan, which tends to have higher monthly premiums in exchange for the flexibilities to use providers both in and out of network without a referral. Also, with the Medicare Advantage plan, you can receive up to $100 gift card yearly for completing healthy actions. So that's like your just yearly checkup, mammograms, anything that is a preventive action. And then also we have 0 to low copays for primary care providers, PCP visits, and network. And then you have the ability to add dental, vision, and hearing coverage for a low monthly cost. And then also we provide transportation, of course, not to the grocery store, over to a friend's house, but for medical use only, to the doctor. So up to 12 one-way trips every year to plan approved locations on Blue Cross Medicare Advantage Premier Plus HMO POS, Blue Medicare Advocate Health HMO, and Blue Cross Medicare Advantage Choice Premier PPO plans. So a total is up to 24 trips on Blue Cross Medicare Advantage Basic Plus HMO POS plans. So we do have other benefits that put you first, which is our prescription drug coverage includes low copays, a network of nationwide pharmacies. All Medicare Advantage plans include Tier 1 coverage and GAP, and then low copay for 30-day supply of Tier 1 drugs at our preferred network pharmacies. And so just once again, there'll be a Walmart, Walgreens, Costco, and then Kroger, which is also known as Mariano's. So other benefits that put you first, we have additional benefits, as I mentioned, that may be a part of your plan. That includes dental service, which is your preventive dental and comprehensive dental, vision care, which is your routine eye exam, frames and contact allowance, and then last, hearing care, which is your routine hearing exam and hearing aid allowance. So this is just your optional supplemental benefits and that you can add on for a low cost of $23.90 per month, which include your preventive dental coverage, which is zero cost sharing for 2 oral exams, 2 cleanings, 1 bite wing, and 1 x-ray. And then here's a breakdown for your comprehensive dental coverage. So we cover 80% for coinsurance for your basic restorative and non-surgical extractions and scaling, 50% coinsurance for major restorative services such as oral surgery, crowns, and dentures. And then also there is $1,000 per year max for preventive and comprehensive dental coverage. So then for your vision services, there's 0 copay for your lenses. And then there's a $150 allowance for frames or your contacts for every year. So you can either use it one or for the other. And then for your hearing services, there's a $5 copay for your routine hearing exams. And then we give a $1,000 annual maximum on hearing aids for every 3 years. So this is an optional supplemented benefit package offered on Blue Cross Medicare Advantage Basic Plus HMO POS plans. And then there are Blue Cross Medicare Advantage Classic PPO plans, and then our Blue Cross Medicare Advantage Elite PPO plans. So now I'm going to discuss plan extras. So Blue Cross Medicare Advantage plan benefits, preventive care and additional services. So as I mentioned, we have 0 to low copay for an annual physical exam in network, and 100% coinsurance for a PPO flex plan. And so our flex plan is a new Medicare Advantage plan. So once again, if anyone on the call is interested in that plan, then I can provide that information to you as well. And then there's $90 to $120 copay for emergency care and 0% coinsurance for our PPO Flex plan. So our PPO Flex plan, once again, is one of our new Medicare Advantage plans that we have available with Blue Cross Blue Shield. And then we also have travel benefits that's available for members who are outside the service area for up to 6 months. So if you know you're going to be somewhere for up to 6 months at a time, or anywhere between 0 to 6 months, then you can call Blue Cross Blue Shield and advise them that you're going somewhere outside of Illinois. Then Blue Cross Medicare Advantage plan benefits. We have a built-in prescription drug coverage and what count towards your initial coverage limit. So there is a $4,430 initial coverage limit. So the initial coverage limit is a total retail value of formulary drugs you can buy before leaving your plan's initial coverage phase. So it could be a $0 to $480 deductible, depending on the prescription drug plan that you may choose, or the tier of drugs that you're currently taking for medication. Also, there we get co-payments and co-insurance, and then what your plan pays for the drugs. Blue Cross Medicare Advantage plan benefits, built-in prescription drug coverage. Next phase is the coverage gap. That's any amount from $4,430 to $7,050. So the coverage gap is also known as a donut hole. That means that there's a temporary limit on what the drug plan will cover for your drugs. So the coverage gap is reached after the $4,430 in drug costs, and all MAPD plans include tier 1 coverage and coverage gap until the $7,050 in true out-of-pocket cost. Excuse me. So the next phase is called the catastrophic phase, which is when you meet that $7,050 point. And the catastrophic coverage, the point is where your total prescription cost for a calendar year has reached a set maximum level. At this point, you're out of the donut hole and your prescription drug coverage begins paying for most of your drug expenses. So then at that point, you pay the greater of, which is either 5% of the cost or $3.95 copay for generic and brand drugs treated as generics, or a $9.85 copay for all other drugs. So you're ready to enroll. So do you qualify for enrollment? So if you do have the Medicare Part A and B, which is your red, white, and blue card, and coverage, enroll in Part B and continue to pay your Part B premium, which is currently at $148.50 a month, and live in the service area of the plan you want to join. So now I'm going to talk about the different enrollment period. So the first one is the initial enrollment period, and this is when you're first turning 65. You can sign up anytime 3 months before your 65th birthday month and 3 months after. This will give you an effective date, usually after the first day of the month following enrollment or the first day of the birthday month. But just keep in mind, if you do have credible coverage, you can delay enrolling into your Part B. If you want to be proactive, you can definitely enroll into that Part A. So if you're retiring or your spouse is retiring, you can just easily navigate and transfer over to your, enroll into your Part B. The next phase is your annual enrollment, which is what's going on now. That's October the 15th to December 7th. So enroll for the first time, or you can switch plans, and this will give you an effective date of January 1st. Then the next one is a special enrollment period, and this is a change of life status. That means you can maybe getting married, moving from a different state, or when you're losing your credible coverage that you have with an employer. This would trigger a special enrollment. That effective date is usually the first day of the month following enrollment. So what are your next steps? Is to review your provider directory and make sure your doctors you see are in our network. You can review also our pharmacy directory and make sure the pharmacy you use is in our network. And then review the summary of benefits. That is the breakdown of the benefits that depending on the plan that you choose. And then you can also talk to a licensed authorized insurance agent like myself. So taking advantage of open enrollment. So open enrollment begins January 1st to March 31st. So if you would like to change your Medicare Advantage plan coverage after annual enrollment, you may choose to switch to back to original Medicare's Part A and B and purchase a standalone Part D plan. And also during open enrollment, you can also choose to switch a different Medicare Advantage prescription drug plan and a different Medicare Advantage only plan. So you can make those changes in the beginning of the year all the way to March 31st. So additional tools that can help you. We have Blue Access for Members, which is our online wellness tools and resources where you can have updates about COVID, resources about blood pressure, and Alzheimer's and dementia. And then it can access via our mobile app. So you can download our mobile app and then you can access your insurance, and then a medical pharmacy claims information. And then we have network providers and pharmacy search. And then as far as education, like the seminar that you're on now, we do have several seminars that we do virtually. You can go to www.bcbsil.com/Medicare/seminars. And then we are hosting a health fairs and community events since we're back out in the field. So if you go to that website, you can find some type of health fairs and community events that we might be holding somewhere by you or close to you that you can drive to. So help is always available. Of course, you can always go to Medicare, which is www.medicare.gov, or call Medicare 1-800-MEDICARE. So if you don't have this information, feel free to write it down. And then also you can go to Social Security. Their website is www.ssa.gov. Their number, once again, is 1-800-772-1213. So those resources is always available if you have any questions or concerns. As far as an enrollment guide and get a complete guide, if you need an enrollment guide and wants to know information about all of our Medicare Advantage plans, once again, if you want to put your email into the chat, I can send you that information. So just additional information, almost done. This information is a complete description of benefits. It's out-of-network, non-contract providers and under no obligation to treat Blue Cross Medicare Advantage members, except in emergency situations. Please call our customer service number or see your evidence of coverage for more information, including the cost sharing that applies to out-of-network services. Blue Cross Blue Shield and the cross and shield symbols are registered service marks of Blue Cross and Blue Association and Association of Independent Blue Cross and Blue Shield plans. Silver Sneakers is a wellness program owned and operated by Tivity Health and an independent company. Tivity Health and Silver Sneakers are registered trademarks of trademarks of Tivity Health Incorporated and subsidiaries, and affiliates of the USA and other countries. Additional information, please bear with me. The prescription drug plan notice, a prescription drug plan provides by Blue Cross Blue Shield of Illinois, which refers to HCSC Insurance Service Companies, which is an independent licensee of Blue Cross Blue Shield Association and Medicare approved Part D sponsor, enrolled in HISC plans, depends on contract renewal. And a Medicare Advantage plan notice, HMO, HMO POS, and PPO plans provided by Blue Cross Blue Shield of Illinois is a division of Healthcare Service Corporation, which is a mutual legal reserve company. HCSC, HMO plan provided by Illinois Blue Cross Blue Shield Insurance Company, which is ILB, CBSIC. HCSC and ILB, Blue Cross Blue Shield IC, are independent licensees of the Blue Cross and Blue Shield Association. HCNSC, Illinois Blue Cross Blue Shield IC, are Medicare Advantage organizations with the Medicare contract, and an enrollment in HCSC and Illinois Blue Cross Blue Shield IC's plan depends on contract renewal. A little tongue twister there. Just additional information, please once again bear with me. Blue Cross Blue Shield of Illinois complies with applicable federal civil rights and laws and does not discriminate on basis of race, color, national origin, age, disability, or sex. And Blue Cross Blue Shield of Illinois does not exclude people or treat them differently because of race, color, national origin, age, disability, or sex. And also Blue Cross Blue Shield of Illinois provides free aids and services to people with disabilities can communicate effectively with us, and provides free language services to people whose primary language is not English. So if you need these services, contact the Civil Rights Coordinator. So if you believe that Blue Cross Blue Shield of Illinois has failed to provide these services or discriminate in another way on the basis of race, color, national origin, age, disability, or sex, you can file a grievance with our Civil Rights Coordinator at 300 East Randolph in Chicago. The email is civilrightscoordinator@acsc.net. And you can file an grievance in any person by mail, fax, or email. And if you need help filing a grievance, a civil rights coordinator is available to help you. And you can also file a civil rights complaint to the U.S. Department of Health and Human Services. Our Office for Civil Rights electronically through our Office at Civil Rights Complaint Portal. And just once again, this concludes our seminar. If your primary language is not English, we do provide various interpreters that can communicate our plans with you at the language of your choice. And thank you for bearing with me at the end. This is the end of the presentation for our Medicare Advantage, the benefits of Blue. So at this point, Emily can unmute the microphones and we can discuss any questions or concerns you have at this time. Thank you everyone for being patient, and thank you for joining us this morning.
Thank you, that's great. So if anybody has questions or if you want me to unmute you, please put that in the chat and we can do that. We did get a request, it's in the chat, for you to send the complete enrollment guide.
Okay.
Do we have any other questions from anybody?
Any questions at all? Any questions about Medicare in general?
I don't see any.
All right, I guess Ms. Sue was just the only one who's just requesting something. The enrollment guide.
Okay, I don't think we have questions.
Maybe coffee hasn't kicked in yet. Still early. It's a nice day though.
Okay, well, I guess we will go ahead and leave it here then.
All right, well, thank you once again, everyone, for joining us. Enjoy the rest of your day. Happy holidays, everyone, and stay safe.
Thank you. Bye.
All right, thank you. Have a good day, everyone.